Percussion of abdomen. With the patient supine and comfortable, use a non-dominant hand as the base and lay down the palmar aspect of the hand on the abdomen. With the dominant hand, use firm, constant pressure applied from the middle finger. You can also use 2 fingers to tap down on the dorsum of the middle finger of the base hand. 2 taps are applied in each region. Start in the right upper quadrant and move clockwise, ending with the epigastric and suprapubic regions. Dullness is typically heard over fluid or solid organs, such as the liver or spleen, which can be used to determine the margins of the liver and spleen. This can help with estimating the size of these organs and can help to identify organomegaly, that is, enlarged organs. Tympany is typically heard over air-filled structures, such as the stomach, small intestine, and the large intestine. How to percuss liver. Start over the right midclavicular line to percuss the liver. To find the upper border of the liver, percuss along the right midclavicular line, starting from around the third intercostal space, down towards the right costal margin, that is, the lower edge of the rib cage. To locate the lower border of the liver, percuss along the right midclavicular line from below the umbilicus, upwards to the right costal margin. A dull note obtained above the upper border of liver dullness may be due to liver enlargement or disorder, either in the lungs or pleura. Tidal percussion is done to differentiate these pathologies. Normally, there is an increase in the area of resonance downwards by 4 to 6 centimeters during full inspiration due to the movement of the lungs, diaphragm, and liver downwards. In upward enlargement of liver, the increase in the area of resonance in deep inspiration remains within the normal limits. In lung pathology, the area of resonance decreases on tidal percussion. How to percuss spleen. Percuss on the left midclavicular line at a level of the 5th intercostal space, that is, between the rib, and work in a diagonal line towards the posterior axillary line, for example, at the left costal margin, to locate the spleen. Castell's sign. Percuss the most inferior interspace on the left anterior axillary line. This is usually tympanic. Ask the patient to breathe deeply. A shift of note from tympanic to dullness indicates splenic percussion sign positive. This is seen in splenomegaly. Nixon's method. Patient should be positioned in right lateral decubitus. Start percussing midway along the left costal margin and proceed in a line perpendicular to left costal margin. Interpretation. Upper limit of dullness greater than 8 centimeters above costal margin indicates splenic enlargement. Test for shifting dullness, which is a way to confirm that the dullness is caused by ascites. Other tests for ascites are fluid thrill and puddle sign, which are explained in the earlier videos. The Hydatid Thrill is a rare but pathognomonic sign of Hydatid disease. The thrill occurs when a mother cyst, packed with unruptured daughter cysts, is gently percussed. The consistency of the wall of the daughter cyst and the tension of the fluid inside it are responsible for making the cyst vibrate and produce the sensation of a thrill. Free fluid from ruptured daughter cysts dampens the vibrations. Normally, the renal angle is resonant due to the colon underneath. In kidney enlargement, angle is occupied by the enlarged kidney in a deeper plane, reflecting the colon in front and medially, making it dull on percussion. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.